And hello, everyone. This is Stephanie Vance, and I've got just a couple minutes after 4, so we're going to go ahead and get started. And we've got a few more folks who are popping in, but we know everyone's time is valuable, so we are going to get going here. I want to welcome you to What Special Interests in DC Can Teach Us About Patient Advocacy. And I know it sounds a little mysterious. Appreciate you all being on the line to glean some lessons from those tactics that Washington, D.C. insiders use to be effective advocates and how it can apply to your own work. So we're going to talk a little bit. Our first topic is just basically going to be about the session. Who's speaking? I know I've spoken with many of you before, but hopefully you will be able to learn a little bit more about me when I show you my picture, so I'm not a disembodied voice. A quick welcome from the National Stroke Association from your fearless leader, Coral, and then 10 effective persuasion techniques. So we're going to go through all of these in just under an hour. We like to get you out a little early just because I know people appreciate that. All right, so about the online training session. Basically what's happening is you are seeing a presentation on my screen. So this is a PowerPoint. We'll be going to different websites throughout the session. Everyone has joined in a mute-only mode, and what that means is that you can speak all you want, but we can't hear you. And the reason why we do that is when we have a number of people on the line, we need to mitigate any background noise by muting all the lines. But the good news is you can ask questions. There's a Q&A box. You'll see a question box with a little plus sign next to it. And if you open up that box, you can type in questions, which I will be happy to address as we go along. I'll also have a series of polls so that we get some practical information throughout the session, help you to develop that plan for effective patient advocacy. One of the questions I always get is the recording and follow-up materials, where we'll be able to find those. So those are available on the National Stroke Association site, and the link is here, and you'll be getting that link after the session as well. And you can also get to it from the advocacy page, which you see when you go to the home page, get involved, there's an advocate link right there. So that's going to be available to you after the session. For right now, you'll see that there is an audience intel worksheet that I'm going to show you on the session, and if you want to have download that before we get to that, that would be fine as well. But you don't need to have that. That wasn't necessarily homework, just a resource for you. All right. So that is about the session. I'm just going to check to see if we have a question at this point to make sure that I'm addressing anything as we move on. All right, I think we're in good shape. All right, so who's speaking? This is me. I'm very airbrushed. I got this nice picture, so I always like to put it up every once in a while. Just so you have a little bit of information about me, I am known as the advocacy guru. I'm a former Capitol Hill staff person. I worked for 3 different congressional offices. I was a lobbyist for a variety of groups, including National Public Radio. And I've authored 4 books, now 5. The last one's called The Influence Game, and it's 50 insider tactics from the DC lobbying world that will get you to yes. And we're applying these in the patient advocacy context in this particular session. So I now want to introduce you to Coral Causeway, who's the Director of Public Advocacy at the National Stroke Association. She is the fearless leader. I've had the opportunity to work with her for a couple of years now. And Coral, I'm going to go ahead and unmute your line so you can welcome our folks, because they are not welcome till you welcome them. So please go ahead.
Great. Thanks, Stephanie. Well, welcome, everyone. I appreciate your time this afternoon. I think for everybody in any time zone, it is still afternoon. Welcome to this Stroke Advocacy Network webinar about patient advocacy. And this is our 5th webinar of 2012. The previous webinars are archived on the page that Stephanie, the web page that Stephanie was just showing you. So you have the ability to go onto our website at www.stroke.org and view all the previous webinars for this year. And along with the previous webinars, there's information about stroke, recovery, and the policy issues that the Stroke Advocacy Network is currently following. We have a lot to cover, so I'm not going to say any more. I will just toss it back to Stephanie in Washington, D.C.
Great. Thank you, Coral. I'm going to mute your line, but do let me know if you have something to enlighten our folks with as we move forward. All right, so I want to get a sense of where we're starting, what kinds of perspectives you come at patient advocacy from. So I'm just opening a poll and asking you if you're a patient, caregiver, family member, medical professional, some combination of the above, or other. And if you're an other, if you want to type into the Q&A box what your other status is, that would be great. And we'll wait a few moments for the votes to come in. We've got 64, 73. Wait a few more moments. Don't want to curtail anyone's right to vote. That's frowned upon in an election year. All right, we've got our votes in. I'm going to go ahead and close the poll and share the results. So you see we've got many people are a combination of these different roles, different perspectives. We've got a lot of family members, so thank you for all the work you're doing, patients and survivors. So that's great. And I just want to check to see, we've got a couple comments here about what the roles are specifically. We've got someone who's a caregiver and also an officer at a stroke support group. And a doctorate of public health candidate. So we've got some folks who are in different parts of the field, but also the patient advocacy techniques we're talking about will work no matter what your role is in the process. All right, so that gives me a good sense of where we're starting from. And basically, I want to make sure that we all know that the first stop for a lot of these resources are the National Stroke Association, not just the webinar recordings that we've already discussed and the PowerPoint slides and materials, but a lot of different information on all things patient advocacy and general policy advocacy as well. Our premise here for this session is really that advocacy is advocacy wherever you are, whatever kind of environment you're speaking in or whatever kind of venue you're working with. So what we're doing in this particular session is, obviously in Washington, D.C. and state capitals, there's a lot of people who know how to advocate, they know how to be influential, they know how to be persuasive, and so we're applying some of the techniques that they use and translating them to what you can do to be effective patient advocates. One of the resources you have that will help you do that is the HOPE Stroke Recovery Guide. And I'm actually going to go to that on the National Stroke Association site. So when you go to stroke.org and you look under the recovery link, you'll see that there is the HOPE Guide link. And you click on that, and it gives you a lot of information about being a stroke survivor and this concept of self-advocacy. Now, I know we're talking about patient advocacy and advocacy sort of from everyone who's surrounding a stroke survivor as well as the stroke survivor, him or herself. I do want to make sure I direct you to Chapter 2 of this HOPE Guide on self-advocacy, because I think that there are a lot of the materials we're going to cover and tactics we're going to discuss are connected to that particular chapter. And just so you know that you're in the right place when you see it, this is what Chapter 2 looks like, that self-advocacy manual that's on the stroke.org site. Now, the reason why I'm highlighting this is because it really does make this point of our premise, which is that advocacy is advocacy, no matter what venue you're operating in. The definition of advocacy, as noted here, is really active support. So it's the act of pleading and arguing for something. In D.C., it's a policy issue. At the patient advocacy, it's usually the access to care, quality of care, et cetera, that you all are working for, either for yourselves or with someone that you're working with as a survivor. So I just, those are some of the materials that are already available on that, which will be in addition to the materials that we're providing in this webinar and the PowerPoint and the worksheet that we're going to show you in a moment. All right, so let's get straight into our 10 tactics. And we're going to do the backwards countdown because those are always exciting. We always want to know what tactic number 1 is. And we're going to start with a tactic 10, which is to really specify the challenges. So in Washington, D.C., special interests will start with why is action needed, who benefits, and why is this a problem. This translates into patient advocacy by understanding really very clearly whenever you're working with a particular patient or survivor, what are the specific concerns in this case? Or if you're a survivor yourself, what are the specific concerns in your case? It may be access to care. It may be coordination of care. It may be financial issues. It may be quality of care. Or it could be some combination, obviously, of the above. I think a lot of times we are dealing with all of those different issues. And if we are, it's very important to understand not just, okay, it's access, but what specific parts of access is it? Is it getting to the physical therapy services? Is it getting to prescription services? Just making sure that we've really clarified down to as much detail as possible what the specific concern is in that case. Because any decision maker, the first thing they're going to ask you is, why is this a problem? And you really need to be able to identify that with some specificity. So just to make sure that you all, as you're thinking about these things, you've started with that particular idea of specifying the challenges. I'm opening up another poll here to ask you for your situation, for the folks that you're working with or yourself if you're working for yourself. What is your main concern? Is it access, coordination of care, payment, quality, or some combination / other? And if it is a combination / other, do feel free to type into the Q&A box what some of the specific concern is in your case. All right, we've got 82% of the votes in, and what's very exciting is it's a tie, a three-way tie between coordination, quality, and some combination. And I should also note that, as we're thinking about this, we'll be talking in the context of individual patients, but I know that many of you are seeking to help groups of patients, and so these same strategies and principles will apply. So do, again, type into the Q&A box if there's a specific challenge that you're facing that wasn't covered broadly here, or what that combination of challenges might be. And I've got one of those, which is robotic therapy approval. Okay, great. So that is really I love that because it's so very specific. And you'll be able with that to really specify what some of the challenges are and why this is the perfect solution to that. So remember, as specific as you can get on the challenge, the better you'll be able to identify your identify your audiences and deliver your messages. All right, so tactic 9 is to specify that solution. So if we look at the example of robotic therapy approval, that's really a solution to a challenge, I assume, of mobility. So it would be really important to make sure that you understand what the challenge is, and correct me if it's not mobility, if it's another issue, but that being the challenge, and what you're proposing is the solution. So special interests are usually really thinking about making sure that they've made that differentiation. You may have your own challenge that is getting a solution to a problem, but you want to be able to be clear, this is the challenge that I'm facing, and this is why my solution is the best for it. Now, so for patient advocates, if the challenge is basically that you're concerned about whether there's too many doctors who are dealing with different aspects of a patient's concerns, what are the very specific coordination strategies you'd propose? What are the insurance coverage precedents? I think that's always very important to get a sense of what's been covered in the past. And then thinking about creative access to care opportunities. Now, one resource I want to make sure that you all know about is the, I'm sure many of you have gone to this site, and if you're frustrated with Medicare, raise your hand on the screen. Wait, too many hands raised. I can't see anything. But I do want to make sure that even if you haven't gone to this particular site, or if you're frustrated with the process, the Medicare.gov site does help provide some information, and it can be helpful in figuring out whether your services are covered. I know many of you are probably under private insurance as well, but I just want to make sure that you're aware of this particular site if you're working with Medicare. Now, along those lines, as you're thinking about why your solution is the best solution, and we'll be talking about how to develop some of those messages, but I also want to make sure that you know about the PubMed site. And the way to access that is at pubmed.gov. And for folks who are wondering if we're going to get all these links, you will have all these links as part of the PowerPoint. But for right now, it's pubmed.gov. And what I did when I went to this site is I typed in the word stroke as a search and found some recent articles and clinical information on this issue. Now, if you've got a particular issue, since we've got the, let me see if I can use the robotic therapy. Let's just see if there's been any particular very specific research done on that we can turn to. All right, so here we go. We've got some recent research on this, and you may be familiar with this research already. One of the reasons why I like to do this is because it is published by the National Library of Medicine and National Institutes of Health. So if, when you go to a government agency and you say, hey, your own information says this, it can be really useful in getting some of that coverage. And I see here that you've got, that you yourself have been in a study about robotics, so appreciate that. Your challenge is trying to prove that it's not experimental therapy, and I think some of this information may help you there if you haven't already found it. So just making sure that as you're developing what your solutions would be to those problems, that you have access to those resources and make sure that you're reviewing those. Because, again, that's going to be one of the things that the decision maker is going to want to most know is why what you're proposing solves the challenge that you've outlined. All right, so tactic 8 is to know the steps and the advocacy opportunities. So in Washington, D.C., as special interests, that would be knowing how a bill becomes a law, all of our favorite schoolhouse rock stuff. So introduction, referral, committee review, floor votes, and then analyzing within that where advocates have the most opportunity to make a difference. So if it is introduction, we'd want to make sure that we know where advocates are able to get members of Congress to introduce legislation. If it's committee review, we'd want to get advocates connected with committee members. In the patient advocacy world, to me, this means knowing the venue in which you're operating and knowing the steps that you'd obviously need to be going through to deal with whatever your particular challenge is. So if the steps are pre-admission, admission, hospital stay, outpatient, and the billing and payment process, those are some of the steps that obviously patient advocates are dealing with a great deal. And what I'd like to do is to ask people to type into the Q&A box what some of the steps are in their process for their particular patient advocacy effort. And I'll take a moment to let folks type into the Q&A box their particular steps. And the reason why I'm asking you to do this is I hope you can take this information after the session and apply it to your own advocacy, patient advocacy plan that I know you'll all be developing. All right, great. And I've got someone here whose step that they're working on is the billing and payment step, which is always one of the most challenging. And always difficult to figure out where your access is, but we'll talk about that in a moment. All right, great. And I've also got one who's talking about outpatient care, that's an important step in their particular advocacy process. So, all right, so that was tactic 8, is to know the steps and the advocacy opportunities. So we've also got one on outpatients with coordination of care and billing. So that's an important step in the process. So tactic 10, specifying the challenges. So hopefully everyone's written down their specific challenge. So if it may be mobility, it may be that we've got too many folks who are looking at a particular stroke survivor and that all of the information is not coordinated and is sometimes conflicting. We may have that the particular patient can't pay for a particular service. Those are the challenges. What are the solutions? So we looked at the robotic therapy solution, that would be a solution to a particular concern that one person has. Taking a look at some of those other solutions for your own situation is good. Number 8 is to know the steps of that particular process and the advocacy opportunities. You need to be as familiar with those steps as the people who you're trying to influence, because often those folks who you are trying to influence don't really know whether those they may not know all the creative options in those particular steps. So sometimes you're going to need to actually suggest things that they might be able to do as you're going through the different steps of the advocacy effort. All right. And I had a couple more comments here on some of the steps that people are working on, transitioning patients from traditional OT and physical therapy to a wellness program, which is really important and I think has to deal with the outpatient step of the process. All right, tactic number 7, to know the rules. Now, for special interests, that means we need to understand the rules in our particular situation, which are ethics restrictions and parliamentary rules. For patient advocates, that really means knowing with intense specificity, knowing better than your audience what some of the rules are that they're operating under. So that's going to be, if you're working with Medicare restrictions, insurance restrictions, for individual patients, the financial restrictions that they're working with, the restrictions that medical personnel sometimes have. A good example of this is nurses sometimes don't have the ability to prescribe certain things. They have the ability to look at a patient's chart and perhaps suggest very kindly to one of the doctors that some things may be overlapping, for example. But we need to understand what some of those restrictions are that the people we're working with face, and then how that ties back to our challenge and our solution. So for that particular question, I'm going to do another quick poll here and ask you what rules are critical for you to know in your situation. And again, we've got some of these listed here. Medicare restrictions, insurance restrictions, your personal finance restrictions, or the finance restrictions of the folks you're working with, medical personnel restrictions, or again, some combination or other. And we'll wait for those votes to come in. And if you're some combination or other, do feel free to type that into the Q&A box so we make sure we get everybody. All right, we've got our votes in. We're going to close the poll and share the results. So these are some of the rules that are really specific for your situation. We've got a really nice mix here, Medicare, insurance, personal finance, medical personnel, and some combination. The reason why I like to focus in on this is because I think that a lot of times we figure out what it is we want, we figure out our solution, we learn a little bit about the venue in which we're operating, and we know the steps, but then we forget that people who we're talking to have certain restrictions under which they must operate, and either you need to take steps to change that restriction or you need to operate within that environment. So always good as you're developing your patient advocacy plan to understand what some of those restrictions are up front so you're not surprised by them when you get into the process. And I'll go ahead and share the results. You'll see the nice mix that we have of different kinds of restrictions that people are dealing with for their own specific situations. All right, so that's tactic number 7, which is to know the rules. And I'm just going to check here under the Q&A, see if we've got any questions or if we've got any folks who have any comments. All right, I think we're in good shape for right now. Then tactic number 6 is to know what and who you are competing with. In the special interest world, this may mean other special interests, time, attention, and particularly for the Washington, D.C. world, as you probably imagined, the ideological high ground. People are very interested in making sure that their particular, often partisan perspective is acknowledged. And, you know, a lot of times in D.C. we think that the competition is for money. And obviously it often is, but usually the competition is almost stronger for time and attention from other special interests, and again for that ideological high ground. So in the patient advocacy community, unfortunately this means that sometimes you are challenged, you are competing with other patients, certainly other patients that have different concerns than the ones that you might have. Time and attention, this is obviously a huge competition factor, especially if you're a survivor or a family member or a caregiver and you're trying to get time and attention from doctors and other caregivers. The culture of the organization, I can say that, from my own experiences, having tried to serve as a patient advocate for family members, I find that hospitals are extremely different depending on their culture. Sometimes they're very open to your efforts to try to coordinate and improve quality of care, and sometimes they are not. So it's very good to understand that ahead of time. What is the culture of that particular hospital? Are they open to that sort of advice that you might be providing? And are you competing with a culture that doesn't acknowledge that? And of course, precedent. One of the things that I know we've got some folks from stroke survivor groups, which is very useful. One of the things that I think it's great to talk to stroke survivors in that group about is what are the precedents that they've had with their access to care from hospitals and different physicians. So that they can say, well, I know someone's struggling with this. Let me tell you about what we were able to achieve at this particular hospital with this particular doctor. So if, for example, we're looking at this question of, I keep turning back to the robotic therapy because it's such a great specific example, are there areas of the country where this has been allowed? Are there, besides sort of the study that's been done and the materials that are at the pubmed.gov site, are there hospitals where they're using this extensively? Are there outpatient care facilities where they're using this extensively? And if that precedent has been met, how does that model apply in your particular situation? So that particular precedent can, once you know if you're competing with a precedent where it's not allowed, you can find some of those examples of where it is allowed and then let the folks that you're working with know that, hey, this has been allowed in these particular situations and this is why it's been so successful. All right, great. And I've got a quick note here that someone has had a position created for them as a neuro rehab patient care liaison because they're continuing to pave the way for other survivors. And that's a great example of affecting the culture. If your competition in terms of patient advocacy, if one of your competitive factors is the culture of the organization, this is a great sort of ask, and we'll talk about some very specific kinds of asks you can make to make some changes to that culture. And this one that is the example is someone's had a position created for them as a patient care liaison. So that is great. And even if you can't have your own position created as that, asking that someone in the hospital be associated with that and perhaps even given that kind of title would be useful. All right, tactic number 5 is to know the influencees. So the influencees are the audience. They're the decision makers. They're the people that you want to have actually make a decision in your favor. And some of the key questions you need to ask about the influencees are what kinds of decisions those particular folks can make. Sometimes you may be, if you're having an insurance situation, dealing with sort of a lower level claims adjuster, and they may not be able to make some of the decisions that you would like them to make. So you need to find out politely through them who does make those decisions. What interests that decision maker? And the reason why I mention that is because one of the things that I always want people to think about is that they are not influencing a job title, they are influencing a person. And no matter what situation you're in, it's not I'm influencing, again, this particular claims adjuster or this particular person who decides insurance coverage. You're influencing a human being who may have a variety of even personal interests that you can talk to them about and start to build that rapport and that relationship. any information you can get on the decision maker's background, and I'm going to give you an example in a moment. I went to one of the websites of one of the hospitals that signed up for the webinar and wanted to show you how I might look at that hospital website and see what kinds of background information I could gather about the caregivers I might be working with, and of course what restrictions the decision maker faces. We talked a little bit earlier about knowing the rules of that particular game in which you're operating and knowing what some of those restrictions are. Knowing how that applies to the particular decision maker you're talking to, I think, is important. Now, let me go actually back to the, I'd mentioned that we wanted to take a look at a specific hospital. I used Winter Haven Hospital as an example because we had someone signed up for the webinar from Winter Haven, and I thought that it was a great example of something that you can use to sort of find out a little bit of information about different people who you might be working with. Now, one of the things that I noticed on this, and there's a lot of information that if you were in this area, I'm sure you would be taking a look at as stroke survivors or caregivers. One of the things I thought was very interesting was clicking on the being a Winter Haven Hospital nurse. And the reason why I like this is because it gives sort of this list of the 2012 Nurses of the Year, shows some of the nurses, leading nurses, and the executive team. And you may not always get this information ahead of time. You may not know this sort of intuitively. You may just sort of learn incidentally that a nurse has been awarded the Nurse of the Year award. But when you click on this link, you'll see that it was Nurses Week recently, and if you know that, you can talk to the nurses in the hospital that you're working with. And it gives you the information about the various nurses of the year. Now imagine the power of you've already looked up this information because you were at the Winter Haven website. You just to kind of poke around and learn about people. You see Sherry Ray, I'm just giving her as an example, RN, who's in charge of quality improvement. You see her in the hallways and you say, hey, you're Sherry Ray. I noticed that you won one of the Nurse of the Year awards. She's definitely going to become an advocate for you within that particular institution. And this is just a hospital example, but any particular, even, if you're trying to advocate with an insurance company, you're trying to advocate with an individual doctor, you might consider looking at some of this information. And even with the Find a Doctor information, I actually went and looked at this and went into the neurology area and took a look at a couple of these. Now, you may look at this and you'll think to yourself, well, there's not a lot of information here, but there are a couple things that I think are very valuable. Went to medical school at the Howard University College of Medicine, did internships at the Naval Medical Center. So this indicates to me that he's got some perhaps expertise or interest in stroke survivor issues. He's in neurology or neurology issues generally as they relate to military personnel. If you've got any of those connections, I might say to this particular doctor, hey, I saw that you did an internship at the Naval Medical Center. I appreciate your work on behalf of military stroke survivors and want to connect with you in some other ways. Again, any piece of information you can gather without making them feel uncomfortable. You've been gathering maybe a little bit too much information is valuable, I think, because you can throw that into conversations. And again, you are influencing a human being, not a job title. You can also get to know some of these influencees and learn a little bit about them. I know that most of the medical facilities that you're working with in the community will have a community calendar, and again, I'm just using this as an example. But when you click on that link and you get access to all the different upcoming screenings and support groups, etc., I know that as when you have a stroke survivor group, you've got all of this on here. Take a look and look at all the other, there's for example, an aphasia support group. Go on here, take a look at all of the other things that are going on, and if you see that there's things that are related to what you're doing, you may find that you have others in the community you can connect with for advocating, or even some of the decision makers that you'll want to meet. So there's just a few examples of how you can float around a particular website and try to get some information that might be useful for you with your cause. Now, as we're looking at that, if someone wants to type into the Q&A box an organization or the website of an organization that they're trying to influence, at the end of the session, I can go to that and we can just do a little exploring on that, so I can show you what I might do to learn a little bit about the influencees as I'm developing my advocacy effort. All right. Now, as you're getting that information, you're going to want to collect it, and this was the audience intel worksheet that I'd mentioned earlier, and it's available on the stroke.org page. And so we're going to go back to that, and that's on the advocacy page where all the materials are and all the recordings are of the various webinars that we've done in the past. And when you click on this link, you'll get to the Audience Intel worksheet. And basically what this is it's just a place to gather all that information that I've just showed you how to gather. Basic contact information if they have an assistant or staff person. And some three key questions that you might want to try and answer here. What gets them up in the morning? So if you see that you found a particular nurse or anyone, a doctor, check to see if you can find their social media pages. Even if it's an individual who is associated claims adjuster at an insurance company, researcher, just obviously you don't want to make them, again, feel uncomfortable, but, it's good to learn a little bit about them. Get some of their bios, previous employments, etc. Check their organization's mission on their website. Put some of that information down. Also, what keeps them up at night? If you were in their shoes, what would be important for them to, if you were in their shoes, what would be keeping you up at night? What would be you would be concerned about? And when you figure that out, you can actually work into the conversation, I'm sure such and such concerns you, and I want to make sure that you know how our solution will actually help you solve that problem. Also, as part of the Intel worksheet, what materials have they asked for? And my key point for that is to provide what they want, not what you want to provide. So, obviously sometimes we have to provide mountains of information, and sometimes we have to provide a smaller bit of information, really depending on our audience. So we need to make sure that we understand what it is specifically that decision makers want, and then, of course, some basic details about the background of that person and your connection with them. Another thing I always like to make sure we've checked on as we're trying to learn about our decision makers is whether we have any mutual Facebook, LinkedIn, or Twitter connections, to take a look at your page, if you can find their page, see if you know someone who already knows them, because you may be able to get to that individual through the person that you already know. Now, that said, remember looking back at some of the restrictions they may have and some of the elements that you're competing with. So if one of their restrictions is that they can't really mix their personal and their professional life, that's fine. You know a little bit about them, and maybe they can't make those connections, but it doesn't do you any harm to take some of that, to look some of that up and get some of that background information. All right. I do have a couple sites to go to, or different hospitals to check out, which I'll do at the end of the session, so that everyone can see some of the ways that we might do that. And as I mentioned, provide what they want, not what you want to provide. These are two different things. Remember, when we're trying to influence a decision maker, we're trying to look at it from their perspective. And in Washington, D.C., that means for us knowing what kinds of bills a policymaker has introduced. But in the patient advocacy context, it may mean understanding what challenges they face and then helping them understand why your solution connects to that, and then giving them what they really need to help you make your case, to help them make your case in the particular environment that they're working in. All right. So I know we have about 15 minutes left here, and I just want to go through our remaining tactics, and then we'll look at some of the very specific examples that people are asking about. So after we've known a little bit about the influencees, the people we want to influence, then we want to assemble our team, which are the influencers. Now, in special interest in Washington, D.C., there's a lot of different kinds of influencers you might approach. Policy experts, strategy experts, people who are experts on the process, the legislative process, different kinds of connections that you might have with the elected officials, grassroots, grasstops, lobbyists. Special interests always think very strategically about everyone who surrounds the decision maker and how you can get to those individuals. Patient advocates, you may find those influencers from a huge range of different areas. The key is to know enough about the person you're trying to influence that you know who already influences him or her. So sometimes you are not the best person to make your case. Sometimes it may be, the perfect example of this is in the when you're trying to coordinate care. Sometimes as a family member, you may not get as much attention as you might like, and the individuals you're working with may be willing to give more attention to another medical professional. So you would want to find those influencers, the people who are going to influence the decision makers, and get them to make some of the asks for you and present the challenges and present the solutions that you have. So, there's so many different ones to look at. I'm not going to go through them all, but the key here is as you're developing that campaign, really think about your specific audience and think about if this person is making the decision, which very specific person influences the decision maker, and then get that person on your team. All right, tactic number 3 is crafting that message, and I created a special new acronym for you all. I love acronyms, and I wanted one that was just for you. So this one is STROKE, and it stands for Specific, Timely, Relevant, Obvious, Key, and Engaging. And so the specific is to be very specific about what you want your decision maker to do, and to remember that you obviously have an overall goal, which may be to promote a certain kind of coverage of a certain therapy. It may be to better coordinate care for a specific patient. But there's also a lot of easy specific things you can ask them to do to move them along and build your relationship with them. So the specific part of your message may be, I have 4 very easy asks that you can make of decision makers you're working with. One is to find you on Facebook and like you so that they can follow what you're doing, and if you're part of a stroke survivor group, to follow your survivor group on Facebook, and this obviously applies to Twitter, etc. I think, too, that, and I'm going to take you to the Stroke Association Faces of Stroke campaign. If you have a stroke story on here, just ask your decision maker to go look at it. And you can send them the link. You can say, hey, we've been talking about this particular issue for a long time. I want to send you the link to my story on the Faces of Stroke site, and just ask you to take a moment to look at it. Very easy ask and helps you build that relationship. And if you don't have a story on the Faces of Stroke Public Awareness Campaign, why not? Go have one. Now, the third very easy specific thing you can ask them to do is, we've got some folks who are from survivor groups. Ask them simply to attend a survivor group meeting, even if they wanted to do a brief presentation at it. A perfect example of this as it relates, as it connects back to the special interest area, is we recently had a briefing here in Washington, D.C. On AFib issues. And a number of members of the Stroke Advocacy Network asked their members of Congress to send a representative from their office to that briefing. And it really got staff turned out, and it was a very easy ask to ask someone to go and attend that briefing. And not only did it get people into the briefing, but it also got people starting to be engaged in the advocacy effort. And the fourth very specific easy thing would be to ask your decision maker to take the 5 Faces pledge. Basically, this if you haven't taken the pledge, again, why not? Go do it. It teaches people about the FAST acronym for responding to stroke, and telling five people about that, asking them to just take a pledge to tell 5 people. Again, very easy, specific asks your decision makers can do, and it helps get them more engaged in the issue that you're raising with them. All right, so back to our acronym, timely. Obviously, as you're developing your advocacy effort, you want to make sure that you're making your asks as they relate very specifically to an issue that's happening right then. Now, when it's very specific patient advocacy, obviously those are obviously medical related, but sometimes those timely asks are related to outside events. So, for example, World Stroke Awareness Day is October 29th. I think that's the right date. And that might be a time to ask someone, in honor of World Stroke Awareness Day, would you be willing to do X, Y, Z to express your support for our particular issues? Very timely, rarely relevant, very well connected to trying to get them to advocate on your particular issue. Relevant is knowing, again, who you're talking to and what is their very specific role in the process. I see too many advocates, both in DC and at the patient advocacy level, talking to people who can't solve their problem. So not that I don't think you should talk to people all the time, make sure people are aware, but you really want to focus in on the person who can solve your problem, and that's why it's so important to figure out the roles of the various decision makers. Obvious. Sometimes your message seems very obvious to you, but it's not going to be obvious to your audience. And I find a lot of times you need to step back and really talk about it from a very personal and very basic level. And it makes a lot more sense to folks when if you're talking about a particular solution, you talk about a very specific personal challenge that relates back to that solution. So obvious is hopefully obvious. Key, there's 3 keys to that message that you're developing. The first is to know that audience. The second is to make sure that your concern connects to that audience. And the third is to make sure that your message is engaging enough that that audience will pay attention. So those are the 3 keys. That's the K, and relates back to E, which is engaging. Those faces of stroke examples are perfect because they're very engaging. They've got images. They tell those stories, and that's really what you want to do when you're talking about crafting a specific message. Now, again, you may be thinking, well, my deal is I want this very technical thing to be covered by these very technical people. But again, remember, you're talking to people, not job titles. So these techniques really work because a lot of times, people tend to talk to them at a very top level, and they forget that you're talking to an actual human being. Except in Washington, D.C., sometimes you're not doing that. All right, so that's tactic 3. Tactic 2, obviously know when to bring in a professional. Many of you have been in a situation where you've needed to do this. You may find that you don't have the expertise, the connection, the financial resources, or the time resources to really achieve the goal that you're trying to achieve. That's when you really need to assess your own situation. If you are thinking about doing something very grand scale, it may not be that you would be the only person who could work on this. So just be realistic about what you can actually achieve, and don't set goals that you can't achieve without bringing in a professional if you can't afford to bring in a professional. And finally, tactic number 1, I know it's the most boring tactic, but it really works, is to persist. In Washington, D.C., it takes on average 7 years for a bill to pass through the legislative process, and that's certainly frustrating often for special interests, but it's certainly, persistence is the thing that gets things through the process, and an effective long-term advocacy campaign effort. So I hope that you all will apply tactic number 1 often, frequently, all the time. And to make sure that you've got some ideas out of this, this is our checklist for how you develop your advocacy campaign. And I want to make sure that you all did by asking you to type into the Q&A box something very specific that you're going to do as a result of what we discussed. You're going to go view the Stroke Association resources. Are you going to do a little bit more research into influencers, review the websites of some of the decision makers you're focusing on, craft that stroke message, etc. So type into the Q&A box something specific you're going to do. And while you're doing that, and I'm just going to, I've got one, again, let me know if there's an organization you want me to take a look at. I've got two here actually. I'm going to use Mountain View Regional. And so if I look at the Mountain View Regional Medical Center, I would first of all click on the About Us link. And we see some of the information about their services and their general information. I would click on the Meet Our Officers link. Really important things that I would want to take a look at under these would be their bios, because we see where they're from, what kinds of hospitals they've served, what some of their roles have been in the past, what some of their interests are, what some of their degrees are in, physiology, a Bachelor of Arts degree in French. Hey, if you speak French, that would be a useful connection to make. Just to know what some of the roles are, who some of the people are, know some of their background. That can really help you start developing a network that is going to be most influential with these individuals. Obviously, I'd also click on the Find a Physician link just to see if there is any information about the various physicians at that particular hospital. For some reason, my site isn't working right now. But to take a look at that, see if you can find any of the, oh, here we go. So what I would do is to just type in the name of the doctor that you're working with and see if you can get any background information on them there. So again, browsing around the websites of some of the decision makers that you're working with is useful to find some of that personal information. And I've got some folks who are actually going to be doing that, so that's great. Again, type into the Q&A box anything that you are specifically going to do as a result of what we've been talking about. I've got one that was Glen Falls Hospital. Do you want to tell me what state Glen Falls Hospital is in? And we can take a quick look at that site just to let you know how we would do that. I got a lot of Glen Falls here. New York. All right. So let's just take a quick look at that. Glen Falls Hospital, New York. And again, I know you're not all Glen Falls Hospital, but this is how I would go through and do some of this research. So Glen Falls Hospital, we would do, first of all, always the best page is the About Us page. No one ever looks at the About Us page, but this is where you can find some of this great information. I might look at the Board of Governors. So when I look at the Board of Governors, I see some folks in the community who already have some really good connections with this particular hospital. I would look at all of these individuals and see if any of them are people who I already know, who are already part of our stroke survivor group, who are connected with any organizations that I know of in the community. I would also look at all of these individuals and see if I can find them on Facebook, Twitter, YouTube. We've got an insuring agency here. I would see if I could take a look at their business website. King Arthur Flower, that looks interesting. Just to really narrow in on these people, because they are going to be the influencers of decision makers, administrators in the hospital. So if we look on the administration, we'll get some of that same information, some of the names. Now they don't have the bios on here, but you can do a little bit more research on them and get some of that background information. So that's one of the ways I would just start in learning about who some of the folks are that you would want to connect with. Definitely there's a lot of information on here you can prowl around and find. With that, I know that we are nearing the end of our time here. I want to thank you for taking some of the time to chat with us, and I hope that you got some ideas out of this, some ideas of what we do in Washington, D.C. to be effective influencers. And if you have any questions, do feel free to follow up with Coral or myself. I'm going to put our contact information on the next slide. All the materials are available on the stroke.org website, so you can see it yourselves and watch it over and over again or share it with others. That's always our intent here, is to make sure everyone's got the information. So thank you again. I think you're ready to go off into the world, be effective patient advocates, and have a great afternoon.